Hello and welcome to this Edison TV executive interview where we are speaking to Basilea. We are joined today by David Veitch, Chief Executive Officer, and Adesh Kaul, Chief Financial Officer. First, we're going to be speaking with David. Welcome.
Thank you.
So Basilea has a strong track record as a pure-play anti-infectives company globally. In your own words, what do you believe it is that has given Basilea this edge in what is ultimately a fairly challenging space?
Yeah, I think Basilea is focused. I think the first point is focus. So we focus on the treatment, the development, commercialization of antibacterial and antifungal products. I think that is key. I think secondly, having the right business model. Yeah, and our business model where we acquire the best assets, we develop them, we get non-dilutive funding where we can, and then we choose the right commercial partners to commercialize the assets. I think that model is also key. And then I think probably thirdly, implicit maybe in the first two, but pick the right products, not just differentiating products that are innovative, but ones that we believe can actually sell. They address a real unmet medical need. They're probably the key factors, I think, that makes us successful in this area.
So with a portfolio now spanning both commercial stage and clinical stage products and drug candidates, what are your key strategic priorities across the next 2 to 3 years?
Yeah, I think for us, and for, I guess, for most biotech and pharma companies, the sort of lifeblood is the pipeline. So, we've got great increase in revenues now from our commercial products. So we will continue to keep focusing on supporting our partners to generate as many sales as they can of our commercial stage products. But really the focus of sort of senior management and a large part of the company is on the phase 3 assets, on bringing those to market as quickly as possible. So fosmanogepix, which is in phase 3, and then bring in ceftibuten ledaborbactam to start the phase 3 studies. They're probably our key sort of strategic priorities, but they're not forgetting also to bring forward the earlier stage compounds towards later clinical stage development.
So the company has had long-standing associations with groups like BARDA, alongside others, which has provided ample access to non-dilutive funding. What do you believe has really been driving those collaborations across your programs?
I think one of the reasons why Basilea has been so successful at gaining non-dilutive funding is probably sort of 3 things. One is the quality of the products, because I think BARDA and other non-dilutive funding organizations will only invest in programs they think or assets they think are interesting and important. And then secondly, I think financial viability. So, even though we get a large proportion of our R&D spend funded by these non-dilutive organizations, they don't give 100%. I think we have to have skin in the game, and therefore they want financial viability on our side. They don't want to invest their money and us, not be able to pay our piece of the equation. So actually, I think financial viability, the right products, and then thirdly, it's just the experience we've gained over 10, 12 years of working with them. We've got the skills to know how to work with them, and we've grown together, the non-funding bodies and us, so we've learned how to work together. So I think experience as well, they're probably the 3 key reasons.
Fantastic. Thanks for joining us today, David.
No, thank you.
Adesh, thanks for joining us today.
Thank you for having me.
So Basilea has been quite acquisitive in recent years. With a strong pipeline now in place, how do you see the role of such transactions playing into your strategy and operations going forward?
So we still have the ambition to be the leading company in our space. And we also believe that there is still unmet medical need out there beyond what we are able to address with the assets that we have in the pipeline. And hence, in-licensing acquisitions will remain an important part of our strategy going forward.
Excellent. So with your half-year results just around the corner, what are some of the key milestones that investors should watch out for in the second half of 2026?
So now it is really about execution. Execution on the one hand from a commercial perspective, so hence they should be looking out at the performance of our commercial portfolio in the numbers, and secondly also execution on the pipeline side, which means any kind of progress that we can show with regard to the continuation of the fosmanogepix phase 3 program and the preparation for the start of the ceftibuten ledaborbactam program.
Excellent. If there was one thing that you had to explain that you think might be underappreciated by people about Basilea, what would you like to get across?
I think it's really how attractive actually the space is that we're operating in. People are very much focused on what is actually the peak sales estimates that you can have with novel antibiotics and antifungals. But I think with the right model, what we are demonstrating is that one can create sustainable value if one is the leader and has critical mass with respect to cash flow generation and actual return on investment.
Fantastic. Adesh, thanks very much for the insightful discussion.
Thank you.
If our audience would like to learn more, we refer them to the Edison website, where our research is freely accessible.